So I think that's a really good question, Jen. Um, we should be vitamin D sufficient through the lifespan, you know? Before a woman conceives, throughout pregnancy, during lactation, um, and if a woman's not lactating, and she's providing formula, her infant should be on a supplement, if not meeting a liter of formula a day. If she is lactating, she can either, supplement herself so that her milk is replete. Breast milk is only insufficient if mom's deficient. And again, sufficiency should be across the lifespan. It's not just during pregnancy. So if we achieve sufficiency throughout the lifespan, then you would have women who are getting pregnant who are sufficient, right? And many women, you don't know that you're pregnant for some time, right? Weeks. And so and really important process. I mean, we know days after implantation, your 125 dihydroxyvitamin D levels skyrocket. And that has implications for placentation. And so if the only way to combat that is to be replete before you get pregnant, and why should it just start if you're thinking about getting pregnant? It should be throughout your whole life. Um, and Carol Baggerly, who was the founder of Grassroots Health, and her husband, Leo Baggerly, they absolutely broadcasted that. And, I think there's so much elegant data to support that. It's not just about pregnancy, not just about lactation. I mean, that's my area of focus of research, but it's so important. Um, and if we look at those individuals who grow up or who live in sun-rich environments where they actually have access to sunlight, you see that their levels are at least 40 nanograms per ml. They're 40, 50, 60 nanograms per ml. That's what we should be achieving. And because we have modern day living, we're not out there in the sun. We use sunscreen, which blocks it. And while some sunscreens might not block UVA, many block UVB. And, Bruce Hollis showed that in the late 80s and early 90s. And so, I mean, all you have to do is miss a spot of sunscreen and you see a difference in your skin and so forth. And I'm not saying that you should, I think there are many discussions about sunlight exposure, ultraviolet light, injury to the skin. But if someone doesn't have access to a supplement, judicious sunlight exposure, limited, can get your levels up, particularly in those societies where they have limited access. And, historically, even in areas of the world where, because of religious customs, women were wearing dress that prevented them from having sunlight exposure, they had compounds where they would be able to have sunlight exposure. But now in urban living, there's less access to that. And so those women are particularly at risk. Um, and it becomes generational. And so when you look at the data that says, oh, human milk is really deficient in vitamin D, it's really reflecting a bias, a selection bias. So I hope I answered your question.